Every day on the Suncoast, thousands of people struggle with the challenges of Parkinson's disease, the muscle freezing, tremors, small shuffling steps, and loss of ability to swallow or speak. And as hard as it is to endure, it can be even more difficult to find treatment. But there is hope. It is a nonprofit group on the Suncoast called Neuro, and Medical Director Dr. Dean Sutherland is here now to tell us about it and to tell us about a way that you can help out. Thank you so much for coming in.
Hi Heidi, thank you for having me.
Thank you for coming back. I'd like to disclose that I'm very involved with Neuro. I'm on the board, and my parents are very involved with Neuro. My mom is Parkinson, and it is a wonderful group that provides services that very few in the whole state provide. Tell us.
That's right. We've actually expanded our services to include things that nobody actually in the state or even most parts of the nation have nowadays. We have an integrated medicine program that has to do with Tai Chi and ballroom dancing and acupuncture and a lot of different things that you would normally associate with alternative medicine that's available. And actually, if you look around, it's not available anywhere else in the United States as a true Parkinson's clinic, which we've developed. So we're very excited about that.
Tell us about the clinics that happen each month.
Each month we have the ability for people to come in and be evaluated not only by myself, but also by our nurse coordinator, who's able to put together a care plan for them, which is individualized. So, for instance, if someone is falling down a lot, then perhaps they're not going to do well with acupuncture, but they might do better with Tai Chi, or they might need some physical therapy and occupational therapy at that point. Alternatively, if they're having problems with swallowing, they might want to see a speech therapist, but also maybe get involved in some other activities that will allow them to get out and sing and do things. So in other words, we're trying to do very broad treatments for everybody, individualized treatments. So in addition to myself and the nurse coordinator and the PTOT and speech therapy people that you would normally see in the clinic, we also have a lot of seminars that are available for people to go to. We have a very big one coming up in January. We're going to bring in a stem cell researcher to talk about the latest. When the skin cells get transformed into being stem cells, they can be given back to Parkinson's patients potentially. That's going to be a real winner. We do that every year.
Right, and it has a huge, huge crowd. But all of these things take a lot of money to provide, and there's a way for you to help. There is a golf tournament coming up. Not this weekend, but the next weekend. Tell us about it.
So the golf tournament's going to be at Heritage Oaks. It's going to be a lot of fun. Mark Bisgeyer has helped us to organize this along with a lot of other volunteers. But it's going to be a typical 18-hole tournament starting around noon. We're going to have fun. There's going to be prizes. You know, if somebody wins a hole-in-one. There's also going to be some door prizes that are given away and some raffle items. There's going to be a large screen TV. There's going to be a lot of coupons for local restaurants.
And I think one of the holes has $5,000 prize, right?
That's right.
So a great way to make some money, too, if you would like to
and have
come.
fun with your friends.
Well, let's tell everyone how they can take part if you're interested. It is the Neuro Challenge Foundation Charity Golf Outing, October 24th. Happens at Heritage Oaks Golf and Country Club. If you'd like more information, call 400-7867, or you can call the Neuro Challenge Foundation helpline 926-6413. And of course, if you need more information, go to our website, mysuncoast.com, and click onto Health Smart. And you might be hearing about this one more time before we have the tournament, because we might be talking about it. Dr. Sutherland, thank you so much for coming.
Thank you.
Caregiving for Parkinson patients can be a full-time job. It is hard physically and emotionally, but we have help. A free event coming up this weekend in Sarasota. And joining us now with more is Doreen Sutherland, president of Neuro Challenge Foundation. So nice to see you again. Thanks for coming back.
Thanks.
What is this free event?
It's called the Caregiver Cruise. It'll be on Saturday, and what it is just fun for caregivers. They need time out. They need to have all kinds of fun things. There should be all kinds of prizes given out, from manicures to exercise plans to information. We're good at giving information, so there'll be that. It's just a day out.
It's a day out, so yes. It's a little bit of respite.
Exactly.
But it's also about information. Tell us about that.
Right. Well, what we do at Neuro Challenge is we're trying to get all resources that we have in Sarasota County out to people. So that's part of what we're going to be doing on that day, is giving people information about what they can do to make their lives easier while they're helping their loved one.
And why is it so hard to care for someone with Parkinson?
Well, one of the reasons, and I can speak from personal experience on this, my dad lived with us for 12 years, from the time my mom passed away until he was 90 years old. I had 4 children during that time, and my picture is putting my dad in a wheelchair, putting 2 children on top, putting 2 people out front to clear the way, and getting through an airport. Was I depressed? Yeah, part of the time I really was, so I understand what people are going through with that. We need to get people the information we can as easily as we can because they're not really able to get out, process that information themselves, and find what they need.
Mm-hmm. So it's very depressing. It can be very depressing.
Not for everybody, but there's a study out there, 46% of caregivers overall in our country experience some kind of depression.
And it's also hard watching your parents deteriorate.
Yeah.
It really is. And Parkinson is such a devastating disease. It can go slowly or it can go quickly, and in my family I've seen it do both. But it is very hard. And also it's a financial toll. Tell us about that.
Yes. Caregivers, on average, $13,000 a year that they're losing of their own income. And of course, there's lots of expenses that go into caring for somebody and making sure that they have the best care that they can get and get that extra time where they feel well during the time that they have Parkinson's disease. I think that there is probably about $5 million in our community of resources that are going unused by the 15,000 people that we care for. We know that. We're trying to bring them in, get them to the places they need to go. Who wants to throw $5 million in the trash in our community?
No one.
We don't want to do that.
So this Saturday they can come and they can go to this event. They'll get a little bit of levity in their lives. But also tell us, can you bring your Parkinson's patient with you? Your
definitely.
loved one?
Bring your the person that you're caring for. They'll enjoy it too. We got little drinks with umbrellas in them and candy and food and just lots of things. So they'll be busy. The caregivers can be busy and travel with them as they go and check out all the stuff that'll be there.
So you can bring everyone
Definitely.
along. Well, let's tell everyone how you can be involved. If you'd like more information about the Caregivers Cruise, which is a fun theme name for a sort of a serious and yet lighthearted event. It is this Saturday, September 26th from 10 a.m. until 12 p.m. It is at Sarasota Memorial Hospital's Institute for Advanced Medicine. That's on Clark Road near I-75. The number is 926-6413. Again, it's a free event, 926-6413. Doreen, thank you so very much for coming. We appreciate it. And now a Suncoast group helping people with Parkinson's disease is now getting national attention. The medical director of the National Parkinson Foundation is in town to tour the Suncoast facility of Neuro Challenge. And joining us now is the medical director of the National Parkinson Foundation, Dr. Michael Oken, and also Dr. Dean Sutherland from Neuro Challenge here in Sarasota. Thank you so much, both of you, for coming in.
Well, thanks for having us.
Dr. Oken, let's start with you. Why would you come all the way here to check out Neuro Challenge?
Well, we have Parkinson centers all over the world internationally, and there's some really, really exciting things going on right here in Sarasota, and lots of people with Parkinson and lots of hope for treatments, and we need to start to plug those people in, and so we're excited about what we're seeing light up on the map here.
And Dr. Sutherland, if you could tell people who aren't familiar with Neuro Challenge, what is it and what are you doing?
We're a foundation that was started here around a year and a half ago, Heidi, to provide extra services to Parkinson's patients. So not just seeing your doctor and your physical therapist, but also things like integrative medicine. You don't see that in centers anywhere, basically, in Florida, as far as I know, in terms of an integrated program with the doctor and the other modalities. So we're talking about Tai Chi and yoga and acupuncture and things like that. So that's pretty unique. We're also trying to expand social services so that people always will have access to somebody they can talk to during the week about their condition, not just their Parkinson's disease medications, but also about their financial situations, their planning, what are they going to do with their lives for the next 10 years. That's very important. Getting hooked up with attorneys and healthcare attorneys and things like that. So we're trying to have an entire package of services that we're developing, and it's well underway at this point.
And my mom has Parkinson, and I'm very involved with Neuro Challenge because I personally think that this is a great service here for our community. And Dr. Oken, I know the drugs that my mom is taking. Are there any other drugs on the horizon that give us some hope?
Yeah, so there's a lot of hope, and let me just say and add to what Dr. Sutherland said, that this concept of taking care of patients really is unique, and this interdisciplinary concept is so important for the field of Parkinson, both for translating from care to research. And on the horizon, we have lots of exciting things that are in testing right now. There's lots of brain receptors that are lighting up, not only for symptomatic treatments, so something that can meaningfully help people today. So we have a number of those things that are in trial. But we also have some things on the horizon for tomorrow. So we're able to grow stem cells. We're learning how to make them, do what we want them to do, turn them on, turn them off. We can shoot genes in. We can combine genes with stem cell therapies. And we've got a number of other interesting pump therapies and factors. And we're starting to get to the bottom of the causes. And there are several causes of Parkinson. And so as we're unlocking this mystery, it's important to keep up hope. I like to tell people it's not a bad time to have Parkinson because the field is really starting to mature. And then for the people that have it, we've got to do a better job, like what Neuro Challenge is all about right. Taking care of the whole patient.
Well, thank you both so much for coming in. And there is a golf tournament tomorrow for Neuro Challenge because, of course, all these services take a lot of money. It happens tomorrow at Heritage Oaks Country Club. And if you'd like to register, there's still time. All you have to do is call 400-7867 to register for this great charity golf outing at Heritage Oaks. You can also call the Neuro Challenge Foundation helpline, 926-6413. We'll be right back.